Nervous to do this?
A little bit. I always get a little nervous, and once I get going, it's a breeze.
What?
I don't know. It's unusual talking live to people that you can't see and get feedback from.
That's like,
you know what I mean?
That just fades into the background.
Yeah.
Like 3 minutes in, it's like, oh, you don't even realize you're live.
Yeah.
Are you nervous to talk about this particular subject?
I think it's just, I feel like we need to inform people about what's going on behind the scenes.
Mm-hmm.
So am I nervous? Yeah, a little bit. But I feel like it's our duty to share.
I do as well. That's why we're going to do this on YouTube. YouTube, please don't kick us off. We're just going to have a conversation here.
Exactly.
Susan Wojcicki. Sitting down with Dr. Mary Caire, who's been treating patients
since the beginning of the pandemic. Since graduating from medical school in 97, a long time. But more recently, the pandemic, I've been, knee deep in all of it.
And and you're stationed in Dallas, correct?
I'm in Dallas. I did a double residency in internal medicine and physical medicine and rehabilitation, and then a 2-year fellowship in functional medicine. So I have a wellness concierge type practice that's outside of the system for a reason, so that I can give the type of care that I want to give to my patients. And so it involves preventative medicine, but then through the pandemic, I've been treating a lot of COVID.
Mm-hmm. What's that been like?
In some ways easier than one would think, because I had no deaths and no hospitalizations. I had one patient who notified me that they had COVID a little bit later and went for a chest x-ray and was discharged from the ER without any problems. So really hardly any complications. But I had to do an incredible amount of research and dig through and form my own opinions and treat each patient as an individual instead of, one size fits all.
Yeah.
So from an outcome standpoint, it's been good because my patients have all done really well and no one's died. But from a practical standpoint, the way I feel about trying to get the right things to my patients, and concerned about if I say the wrong thing or if I do the wrong thing, potentially being long-term repercussions that could affect my ability to practice medicine in the future, have been a major concern. And one of the hardest things is to stand in front of an individual patient and say, for these reasons, you might want to consider these options. And for these reasons, you might want to consider these options, and being fearful that if I said anything incorrectly, there could be long-term repercussions for my patient and also for my career. So it's been a tough time. Informed consent has been almost impossible to get because we don't have as much data as we normally would for any type of treatment. And technically, if we're giving any kind of treatment, we should be able to give a patient a reasonable list of pros and cons and allow them to either say yes or no to that treatment. And that's been more difficult because the science isn't there yet for us to be able to do that. So informed consent has been an issue. Concern over political repercussions of how something might be interpreted, as far as your treatment plan and why you're recommending it, and how that could be scrutinized by people who have not gone to medical school, or and then probably the biggest problem has been getting the medications that I prescribe to the patients, and kind of this bullying mentality that's been going on between the pharmacist and the doctors, because the doctors have the license to prescribe certain medications, but the pharmacists think that they have the right to refuse those prescriptions. And in a way, their license allows them to dispense medication. They cannot prescribe, but they can refuse to dispense if they deem it a danger.
Mm-hmm.
And I think they're basing whether or not something is dangerous on false narrative.
Yeah. So how long have you been treating patients? When did you start treating your patients with a particular treatments that the pharmacists are bullying you about? And
when the pandemic first broke out, I remember it hadn't quite gotten to the United States, and I dove in headfirst into research and really made it my full-time job almost to research, because I was preparing for what I thought was going to be a tidal wave. And in my research, some of the things that I learned about, turned out to have later scientific study that justifies their usage. But in the beginning, you're trying to find the most efficacious agent with the least possible harm, or the biggest safety profile, because it's coming. And I mean, maybe a lot of doctors didn't think it was going to be as bad, but I was one of those that right away understood what we were about to go through and felt incredibly compelled to spend hundreds of hours researching and trying to find the best options, because I literally felt like my research was going to make a difference between life and death for people I care about, my patients, my family. So it was time worthwhile, and the prescriptions or the agents that I chose actually with, in conjunction with other doctors and even discussing it through Zoom meetings with other professionals and coming up with protocols and so I felt like I had a really good grasp on what could potentially help at a very early time, and started prescribing things way before most.
Mm-hmm. Are we allowed to say the?
So the biggest one that I used was Ivermectin.
Mm-hmm.
And I mean, draw your own conclusions as far as, my results are that I haven't lost any patients, but as far as the safety profile, it's incredibly safe and over the counter in most places, and has been shown for a very long time to have antiviral properties that we're still starting to understand, but it's been used for many other RNA viruses. So it made sense to try it for this, because it was such a low risk agent with a potential upside, huge upside.
It's been described as a miracle drug by some people.
In my patients, in some of my patients, it has turned them from extremely ill has contributed to what I believe has played an important role in their healing.
Me personally, I took Ivermectin. I think it helped me as well when I was prescribed, and I got it relatively late in my COVID journey.
Yeah, I'll tell you kind of a funny story that happened during the middle of the Delta variant. Driving down the road, and I hadn't talked to a really good friend from college in a long time, and for some reason I got that kind of I need to call and check in with her. So I called her, and I literally probably hadn't spoken to her in 8 years, but I was just like, hey, just thinking about you. How are things? And she said, I can't believe you just called me. My husband and I are so sick, and we've been to the emergency three times, the emergency room 3 times, and 3 times we've been turned away with nothing. Her husband is a diabetic and high risk, and they told us to come back when you're more sick. And so I decided to help her out and prescribed for her. And in that particular case, it was incredibly dramatic, the improvement in a short amount of time. But it was just one of those weird circumstances where I thought about her, I called her, and they needed me, and I prescribed it, and they had a full recovery. But it was touch and go for before the ivermectin was started. And then I don't mind saying that I personally use it for prophylaxis, because I'm seeing COVID patients all day in my office, or I was at the time, and so I was taking it once a week for prophylaxis, and I felt confident enough in the safety profile that I thought it was worthwhile. It's funny, it's also used for rosacea and rosacea acne type skin things. And so people have taken it long-term for that, even though it's not FDA approved. So there is long-term use data. And so I felt comfortable enough to do that. I thought that was a worthwhile
Yeah, I remember one of the knocks the people who were anti-ivermectin tried to give was like, oh, it'll make you blind. But then you look into like the study that
Actually treats.
that something that
Blind.
actually treats it, but like the only way it can make you blind is you like if you OD on it and take an amount that is ungodly and not practical from.
Right.
You can't even OD on it if you
Right.
if you get like a prescription to treat your ivermectin. Why is the world going crazy? Why? I mean, like you said.
Oh, I do want to say I never got COVID, by the way.
Oh, you know?
No, and I was in the room for 45 minutes with COVID patients all day, every day. So, for whatever that's worth, maybe I'm one of those weird people that just won't get it, or I don't know. I've checked my antibodies. I don't have them. So.
Yeah.
I don't know.
Yeah, I mean, we live in an insane clown world now. This medicine, ivermectin specifically, has been prescribed and taken by individuals billions of times over the last 40 years.
Incredibly safe. And I think, from the results I've seen, effective.
Yeah.
Especially early.
And so, what do you think it is? Do you think it's malice or just straight greed from like the pharmaceutical companies and big pharma? Because you've had instances recently, again, like you mentioned, you were getting bullied by pharmacists who refused to fulfill a prescription that you're giving.
Yeah. I don't know if I want to try and figure out what their motivation is. I just want people to be informed on what is going on as far as, in a doctor-patient relationship, it really should be between that individual patient and the individual doctor to come up with the best possible solution for that exact situation. And there's so many variables. Why there is such a strong medication or this particular medication, and then the narrative on the other side of other experimental things that are not FDA approved. I can't explain it. The layer of complexity that it baffles me completely. Why anyone would want to deny a potentially life-saving medication that has extremely high safety profile. It doesn't make any sense at all. What do you think?
I think there's demons in this world that are. I do think we're like in a battle of good and evil right now.
I feel it. I feel that. Yeah, that's what it feels like on the front lines. You feel like, any step. If you take a wrong step, you could change your life for the better or for the worse at any moment.
Yeah, and just as a podcaster, I've been trying to talk about this for 2 years now, and and tweeting about it. I just you get the censors on you. YouTube's the only strikes that we've ever gotten on the channel. We've gotten 2. It's because we're talking about this, and we're just having a conversation about treatments and the pros and cons of rushing a vaccine to market. And you can't even say, like, YouTube will probably pick up ivermectin and vaccine in their audio reading algo, and they might give me a strike for this just for even talking about it. And they'll probably send somebody to look at the connotation of the conversation and how we're talking about this subject and give a judgment call like, hey, they were pro ivermectin and questioning the vaccine, so that's a strike.
Well, we haven't questioned the vaccine in this particular far.
Not yet, but we're going to. I'm going to. I'm not going to pull you into that if you don't want to be pulled into it. But
I'm somewhat willing to say how I feel, but I'm also willing to admit if I could be wrong.
Yes, and it's just crazy. It's like, why can't we have these kind of things? So what do I think? What is the intention behind it? I don't know. I'm not going to pretend to know. I do think there's definitely a monetary component to it. Pfizer, Moderna, J&J are making a lot of money. In the particular situation that you had recently, the pharmacist was trying to push the emergency use authorized ivermectin knockoff pill that is much more expensive than the generic drug. So
Molnupiravir is the new antiviral that's being offered and under emergency use authorization, not yet FDA approved. But I think what you might want to show your audience what happened, because I recorded a conversation. It had happened so many times where pharmacists had told me that I couldn't prescribe ivermectin. And this particular time I said, you know what, I'm just going to record this because I think this is wrong. And I think this should be a decision between the patient and the doctor, and that the pharmacist should not try and interfere with that decision. And so I was in the middle of pleading my case to a pharmacist, saying basically, I really want to get this prescription to someone who's sick. And this particular pharmacist said, that drug doesn't work, which is not his decision to make, because how would he know if it worked for that individual or if that situation called for it or not? And he said, I won't prescribe it at first. And that's when I pushed record.
And Caire, I just texted you the video. If you want to pull it up, it should be a Zoom link.
And then we can talk about, how often this is happening and really kind of the legality of it.
Yeah.
Because I think that's questionable.
Right, because where is the evidence that, the pharmacist, the only way they can deny a prescription is if they think it's going to harm somebody.
They are there for dispensing and for safety. Mm-hmm. And so they can say no to something because it could potentially be unsafe. But in this situation, it is incredibly safe. There aren't many things that are more safe.
Yeah, but what evidence are they using to say it's not safe? Like, is there any out there? Like, nobody's ODing from ivermectin or...
Right. Well, in this particular situation, he wasn't even saying that it was a safety issue. He said it doesn't work. Well, that is absolutely outside of his scope of expertise and what his license allows him to do. He should not be deciding whether or not a particular drug works or doesn't work for a particular patient that he doesn't even know. Mm-hmm. This particular patient I've known for over a decade. That's a little different than a pharmacist who didn't even know the patient's name, making an informed decision for that patient based on their risk profile. Mm-hmm. And this particular patient, ironically, had reasons not to take, or one of the warnings for not taking the newer agents that the pharmacist was recommending. So this particular patient has some underlying health conditions that involve vascular disease and cholesterol and things of that nature. And there are some warnings. And the drug that he was recommending actually was contraindicated or should be used with more caution in this individual patient. And he was recommending it without even knowing the patient's name or history. So that's the problem.
Yeah, and let's roll the tape, because I've got a bunch of pushers in the pharmaceutical industry. They're like pusher men. It's like that song.
Hi, everyone. Dr. Mary Caire here. I wanted to fill you in on a situation that is unfortunately becoming more the norm than the exception. I had a patient call me this morning who had tested positive for COVID and was having some shortness of breath, some pretty significant symptoms.
Can you blow it up on the live stream?
I called his pharmacy to call in prescriptions that have been shown to be effective, especially with early intervention. And I had a conversation with a pharmacist that I've had multiple times with other pharmacists, but this one in particular, I decided to, halfway through the conversation, push record because it's just gotten to be incredibly common and concerning. So I'd like to play that for you, and I'd like you to draw your own conclusions as to why pharmacists are trying to dissuade doctors from prescribing potential life-saving medications for their patients.
This is at a Walgreens, correct?
It's at a Walgreens.
Here is the conversation.
Been going on every pharmacy that I've called.
If I prescribe it, the pharmacy manager will decide whether or not you fill it, or is it something that I can go ahead?
Well, yeah, because they determine the policy. It's personal. So every pharmacist is right is different because it's their license writing on it, and so I don't want to fill something that they wouldn't want us to fill, so I'll have to get in contact with them. I can take the prescription down, and then they'll determine whether they want to fill it or not.
So the pharmacist determines based on their license whether or not they'll fill a prescription that a doctor prescribes for a medication. I'm struggling with this because I have a patient who has COVID who just tested positive, and I need to get him the prescription right away. And I don't think it's right for him to have to wait for a pharmacist to decide whether or not they'll fill a prescription. If you have it, I would think that you guys should fill it.
This drug isn't proven to work. It doesn't work.
How do you know it doesn't work? There's lots of...
There are multiple studies on it. We have the monoprovir here if you want to prescribe that.
No, I want to prescribe ivermectin, and I have read the studies, and I'm a doctor, and I'm the one who has the license to prescribe it. So I'd like to prescribe it right now for a patient if you have it in stock. I mean, he just tested positive, early intervention. I've read the studies. I'm well aware of them, and I'm using my license and the authority that I have under my license to prescribe this for a patient who just tested positive for a life-threatening disease. I'm just wondering, will Walgreens fill it?
Let me go ahead and take it down.
Okay, and then I can tell the patient that he can come by and get the prescription, or that he'll get a call one way or another that you guys will fill it.
We'll just go ahead and fill it for this one time.
Okay, great. Okay, the patient's... Okay, so I went on to give him the patient information, but what you just heard was a conversation between myself and a pharmacist. He mentioned that he would need to call the lead pharmacist or the managing pharmacist to determine whether or not he would fill a prescription that I was writing for a medication for a patient.
We can pause it there, Carl. We can pick it up from here. So...
Yeah, did you hear him say, oh, we do have that's not proven to work in many, many studies, but we do have molnupiravir, which is brand new. Mm-hmm. And the other one has been around for decades. Yeah. So it made absolutely no sense. And but that particular conversation was one of dozens upon dozens of conversations that I've had. And it's not just that particular store and that particular pharmacist. I just had enough and decided to push record because I felt like it was important that people understood that this is not a decision for a pharmacist to make. I mean, clearly, and it is a decision between myself and that individual patient only.
And
not YouTube, not the pharmacist, not whatever powers that be. It's an individual decision.
Yes. And so you've had many of these conversations.
Dozens upon dozens. And it's a weird bullying dynamic that you see. I had to gently step up and tell him that I'm aware of what my license authorizes me to do, and I'm aware of what your license authorizes you to do, and I'm going to call you out. And most of the time, they still say no. But in this particular case, for whatever reason, he backed down. But he's literally telling a doctor, why don't you prescribe this? When that's not even what his license allows him to do. That's actually practicing outside of his scope. In fact, that could be considered practicing medicine without a license, which is illegal. Mm-hmm. If it did end up where he's dictating what a patient that he doesn't even know or any patient, even if he knows them, that's considering practicing medicine. If he's saying you need to, if the doctor allowed him to practice in such a manner.
Yeah, it seems like we have this. Why don't you prescribe this? Like telling you what to prescribe.
It's very strange. And I've been, I graduated from medical school in 97. I've never seen this degree of insanity. It's completely insane. And then, you have to kind of pick your battles along the way, and you're thinking, okay, do I report every pharmacist that I've talked to in Dallas? And who's going to do anything about it, really?
Yeah. I mean, like the insanity of it all. That's why I like think like, all right, we're in a battle of good and evil. Like, it's so insane that like there has to be.
I agree. I happen to agree with you.
There's
on that
something nefarious going on behind the scenes that, I'm not going to pretend to know exactly what it is, but I'm sure money is a part of it. And I think if you listen to the language of that pharmacist, particularly, there was one line where he basically alluded to like, we're not allowed to prescribe that. Like they're telling us we can't prescribe that. So there's a corporate layer at Walgreens that's sending a message down to the foot soldiers.
Yeah, we can talk about the finances. The prescription that I was calling in cost $34 with a coupon. And the one that he was suggesting that I call in is $700. But he did mention later or earlier, I can't remember, we don't have the whole recording. We didn't share the whole recording because it had patient information in it. But he did say, but don't worry, your patient won't be paying for that. It'll be no cost to them. I thought that was interesting too, because if the patient isn't paying no patient is going to pay $700 for, a prescription that is, well, oftentimes they won't. Some of them will. But I just thought it was interesting that. Don't worry, you go ahead and call it in because it's free to them. Well, this isn't not about what's more, certainly if it was more effective or had more information and more research behind it, I'd be the first one to be calling it in at any cost if I felt like the benefits outweighed the risks.
I get it.
This is not a money decision. This is what's best for that individual patient.
Well, that's if we're acting in a logical, sane world, but seems that we're not. Again, we got pushermen out there. Mm-hmm. The fact that he like recommended the $700 medicine after telling you we can't prescribe this, but we have this $700 pill that you should prescribe. Mm-hmm. It's like that.
He didn't say that it was $700 though.
No,
I looked up the price. I said, in fact, I asked him. I need to retrace what I just said. I actually asked him how much is it? And I think I know now, recalling, I actually looked up how much it was. He said, don't worry, it's nothing to your patient. But he actually did not disclose the cost. I had to look that up.
Yeah. So what do you think's going on at the upper levels of the pharmaceutical world, from the Pfizers and the Modernas to the Walgreens, CVS's, because that's what we were describing. I was telling you when I had to get Ivermectin, we had to call around and find a mom and pop pharmacy.
And it's getting worse and worse, and that's what I have to do too. I used to have to only call 2 or 3 pharmacists, and then finally find someone who would prescribe it. Now it's 5 or 6, 7 or 8, and then more recently, it's been only really the mom and pops for the most part.
What's going on? Are the pharmacists, is everybody under a spell? Are these people?
I think people can draw their own conclusions to that. I don't want to really have anything to do with I don't know what kind of monster would deny a life-saving medication to somebody who's extremely sick. I can't pretend to understand their motivation, or it's baffling to me. And I'm just going to say, I don't know. Yeah. I don't know. But it doesn't make sense.
No, it doesn't make sense. And none of this makes sense. And like you go to the vaccine. God, I'm just like pausing because like, do I want to talk about the vaccine? Yes. It's just like, so
talk about recent.
It's so politically charged, but yeah, like this week, I mean, everybody's up in a tiff because of the leak from the Supreme Court. But the same day that leaked, you had the Pfizer documents drop 80,000 pages, and people are dissecting that data. And there's a couple of researchers who came to the same conclusion independently, which it seems like some of the trial data may have been manufactured. There may not have been as many trial patients as they let on in the data. And then there's a lot of data in there about the effects of the vaccine trials on pregnant women specifically, and it's not looking good. And I've been following this pretty closely for the last couple of years, and I think when you look at everything that's going on in terms of increased myocarditis, just the anecdotal stories of athletes dropping like flies across the world as they're playing their sport, and I think it's becoming obvious that the vaccine is harming some people, not everybody, but it's definitely not as safe and effective as it was originally. Certainly not as effective as it was originally marketed, and I think data may be coming to market that's proving it may not be as safe as was marketed either, which is
it's been an unusual time, but I can tell you the way I handled it in my practice was I was very forthcoming, and I said, I don't know, it's preliminary, the research is still ongoing, it will take years, and I'm old enough to have seen blockbuster drugs get recalled after billions of dollars in sales, and I had prescribed some of those. Fortunately, none of those that I know of had a bad outcome. But one in particular, something as simple as Celebrex was recalled. And so I've seen things come out after FDA approval that were later deemed not safe enough to tolerate, or there were other alternatives that were more tolerable. And I've seen things get the FDA approval process reversed. So I just took the approach of, I can't give you informed consent on this. I can't advise you on this. These are the facts that I know about you as an individual, and these are the facts that I know are potential complications, and then we have to weigh the pros and the cons. And I just took the stance that it's okay, I don't know. And I would just be very, very clear. I don't know. And no one knows, really. Well, we won't know for decades. And given that information, you have to make a personal decision that I will honor and support.
Yeah. And it's, what are your thoughts on the speed with which it was brought to market and the enthusiasm with which it was pushed on people? Do you think that was responsible, or?
I understand that the speed was for a reason that was hopefully going to save lives in a situation that we've never seen in our lifetimes. I understand the urgency, and I certainly felt the urgency for some options for treatment in the beginning, because I really felt like it was going to be what it became, and I felt that early on. So I know what the people behind the scenes were feeling, possibly that we need to come up with a solution as quickly as possible, or potentially millions of people will die. So the speed is not as much a concern as the informed consent to me. If you want to participate in a study, if you want to understand potential complications, and you feel that the benefits outweigh the risk for your individual case, when everything is laid out in front of you, as much as is known, and you decide to contribute to science in that way, using your body with the best knowledge available to you, and you make that decision, that is your choice. And I don't feel like people had the opportunity to be informed because of the speed fully of what the pros and cons could be.
Yeah.
So that's my biggest concern, is just consent.
Yeah. And again, going back to bullying, you had bullying from the politicians, from corporations.
Even the doctors were bullying the patients in some cases,
Oh, my wife's been getting, I should be fair. She wasn't getting bullied, but definitely pressured in the beginning of our visits to the OBG to get the vaccine.
During pregnancy.
And
or first trimester probably too.
Yeah, 2 or 3 times. The first 2 or 3 times, like, no, this is not happening. And they relented after that. But yeah, like, we go in there ask, are you
Well-
vaccinated? You should get vaccinated. It's like,
A lot of doctors fired patients for not getting vaccinated after years of a relationship. I don't see how that's honoring the patient and their right. Like, for example, if someone has a religious belief not to receive blood products, we do the best that we can to find an alternative treatment to save a life in that sort of situation without using blood, because that's their choice. And we honor that. We've always been taught to honor the patient's wishes. It's their body. And so if someone of a religious persuasion that doesn't want blood products comes in and needs blood we won't give it to them. And that can be a life or death decision, and hopefully we can find an alternative. This is a situation where if someone, for religious reasons or concerns or even just any reason, decides that they don't want to participate in a study, any other time in history, we would honor that.
yeah. For some reason, with this particular situation, this outbreak, it's not being honored. I mean, it was such a shame, too, because I'm lucky in my family. There's definitely people on both sides of the debate. But at the end of the day, in my extended family, everybody's like respects, like, all right, that's your decision, whatever. But like, I know a lot of others, though, it's like tearing them apart, where you have people getting shunned, you have people not allowed to go to birthday parties, not allowed to go to weddings, not allowed to go to funerals, and it's incredibly sad how like the politicization of
A health choice.
a health choice is. Again, I'm actually extremely angry at these people for like, the Faucis of the world, the CDC, the FDA, the president, both presidents, Trump and Biden. I mean, Trump was the one who initiated Operation Warp Speed and pushed it. Was very proud to push it on people. Then Biden, obviously, bullying people last winter. You're going to have a winter of death.
I want to speak to that, actually, because when he said for the unvaccinated, it's going to be I remember the conversation. He literally used, this is not exact, but very close. He said, for the unvaccinated, it is going to be a winter of death and maybe despair or some other derogatory, but I remember death and misery or something to that effect. And I thought, wow, he's making a medical prognosis, giving a medical prognosis to everyone in this country who decided to wait. And he's not a doctor. And then I personally found it, and I'm not going to, I found it challenging when he got it into the mic and said, and to you doctors, call your unvaccinated patients and tell them to do this. I thought, again, attempting to practice medicine. Again, it is an individual's decision between their healthcare provider that they have chosen, and it's between two people. And that's where I believe, or even second opinions, third opinions, but an informed opinion. One size fits all medicine has never been ideal for everyone. Everybody needs to assess their individual risks and whether or not the benefits outweigh the risks based on all of the information available. But the information is preliminary, and also the information that is available has been censored. So it's a concern. So I don't hold anything against the doctors that have, acted in their patient's best interest and decided to, based on an individual's risk factor, decided to recommend other options.
Yeah. One thing you're very adamant about too is preventative care, and that's another thing that never really entered the conversation throughout all of this.
That was super frustrating, actually, because I've dedicated my career to prevention, wellness, and little simple things like vitamin D can have a profound impact on contraction and outcome. And that's, pennies or just getting out in the sunshine. I remember a time when, the playgrounds were roped off and the kids were inside all day, and just thinking the best thing for them right now would be the sunshine that affects your immune system and helps you fight things like this. It's frustrating that simple things like exercise, which people were not exercising, they were staying inside. They did not want to be exposed. And ironically, one of the best things they could be doing would be getting out there and exercising and decreasing their inflammatory levels and not being sedentary and getting the sunshine. So it was tough.
Yeah, it almost seemed like they were trying to manufacture a health crisis. Compounding health.
That.
I've been very public about this on this show, but my son, he's 2. We've had to hire a speech pathologist to come because he's delayed on speech because there was the first 2 years of his life. He was born right at the beginning of the pandemic. Every adult that he interacted with out in the world had a mask on.
Important.
And he, due to the lockdowns, luckily was able to hang out with his cousins, and our family made sure the kids were hanging out a lot and all the time. But didn't have like a normal first 2 years of his life in terms of interacting with the world and adults, other kids who had masks on, and so they couldn't read their lips. And he's not like from what we've heard, he's much less behind than a lot of other kids, but it's a big problem. Like you think about like the compounding negative externalities as the years go on. Like when you rip kids out of school, they miss 2 years of school, and at a very formative age in terms of brain function and stuff like that. Like what's going to happen, and how were these potential outcomes not even considered, or if they were considered and the decisions were made anyway? Like who are the people making these decisions? They can't think on a second, third, fourth order effect level, and therefore they should not be in the positions to make these decisions if they're that just surface level.
Mm-hmm. I think that our kids have paid a very high price, and I'm hoping that through education and through nutrition and lots of sunshine, exercise, hopefully their kids are resilient, and hopefully we can just make their health a priority and focus on moving forward and heal any of the gaps that they've missed in their milestones, and just maybe use it as a motivator to really just focus on, nourishing them more mentally and physically, nutritionally. So I think, use this as a wake-up call.
Yes, that's what I think it is a massive wake-up call for a lot of people. And again, going back to preventative health, I think people are starting to realize with COVID particularly, it affected people with a certain BMI and diet differently than those who were healthy. And people are beginning to be like, maybe I should get my act in order. I mean, we see it here in Bickle. Obviously, you were at the Beef Initiative last week or 2 weekends ago. And at least here in like the Bitcoin world, there certainly is like a subsect of people who are like, all right, we're going to get really healthy.
It makes perfect sense. You want to be sovereign from a health standpoint, so it all goes along from an education standpoint, from a monetary standpoint, from a self-governance standpoint. For all of these reasons, you want to be free. And so it makes sense that people who value freedom would want to focus on their most valuable asset and put it as a priority, which is their health.
Yeah. What do you think are some like the low-hanging fruits that people could do out there in terms of getting
the biggest
healthy?
thing, I think it's just to make it a priority, because there's so many things on our plate right now to choose from, and a lot of us are spending our time on things that we may feel are more important than your health because it's easy to put last and you have to put it first. But to be the best version of yourself, and to make the right decisions for your financial future and your education and your relationships and your cognitive function, you really have to be healthy. And so it's really the root of every successful story is health and mental clarity. And we just haven't prioritized it for some reason until there's a problem. And by that point, it's gone pretty far. So it's so much easier, the ounce of prevention, pound of cure phrase. It's so much easier to just build it in and prioritize it earlier before you're diagnosed with some sort of disease that could have been avoided.
Yeah. It's really messed up. You talk about like perverse incentives too. Like, God, I was talking about this yesterday in Archer. I hate all these 3-letter agencies, like the FDA coming out with the food pyramid that is just in the 70s that is essentially led to obesity and diabetes, heart disease, pandemic. That's another thing. Like, when we talk pandemics, like there's an obesity pandemic right now in the United States.
Oh, certainly. And the kids, and the numbers are very high for fatty liver disease in kids, which affects cognitive development, mental clarity, hormone development. And we're seeing a lot of issues with especially young boys having lower hormone levels, or I should say more teenage boys, late teens, early 20s. Their testosterone numbers are lower than they have been historically. There's data that shows that it's a dramatic decline in testosterone levels in men. That's certainly what I was seeing in my practice as I started testing my men, my male, even my teenage patients. Saw a dramatic decline. So things are changing with regard to health, and I think we've just become more sedentary. We've gone for more convenience, such as fast food and processed food. And we've not gotten enough sunshine. We've not had enough time in nature. We're distracted right now, and we can all see why. But it's so simple to redirect. So low hanging fruits, mineral deficiencies are huge. That affects your immunity. That affects your brain function. That affects your metabolism. That affects your hormone levels. That affects your insulin glucose sensitivity. So minerals are low-hanging fruits, and we're not getting enough of those because our soil is demineralized. The problems are big, but they're so simple to solve. Eat foods that are high in minerals, mostly natural whole food type, grass-fed type things, organic if possible. Or low-hanging fruits are just get enough minerals, and usually, unfortunately, now it almost always involves some supplementation. And that supplementation is a tricky subject as well. You want to make sure that it's hopefully manufactured in the United States and third-party verified for purity and potency, and making sure that there's no contaminants and all of that. That's a whole nother topic. But but you can find reputable brands, and you can replace minerals, and that's one thing that really almost anyone can do. And it has a lot of value on every level that I can think of from a health standpoint.
Yeah. Let's see. That's what we've been really trying to hone in on, cooking from home as much as possible. Just bought a half cattle from Cole.
Oh, that's awesome.
At K&C. And that steak is that's a good thing too. The good food is tasty as well. And
you're not as hungry throughout the day too when you eat nutritious food. I think my theory is that we're all hungry and constantly craving carbs because we're on that. Well, first of all, we're nutrient deprived. We may have plenty of calories, but the nutrients in those calories are so minuscule that we're constantly craving something to replace those minerals. And I don't think we ever really get all of them without supplementation unless you're on a first generation farm in the middle of nowhere. Maybe you can, but or maybe if you're subscribing to regenerative farming, which is just starting to become a thing that is discussed and implemented.
Mm-hmm.
But if it's not a priority, it more than likely you're nutritionally deprived.
Yeah. I mean, it's just like fractal complex systems. Like the soil's a complex system. We mess that up, and then the body's a complex system, and due to the complex system below us and the soil being messed up, it's messing up our biome.
Complex, yes, but resilient and easy to fix also, yes.
Yeah, we have to have an optimistic tune to this. We can fix it.
It is fixable. I've seen it all day, every day of my career since I switched over from regular traditional medicine into functional medicine. I mean, that's all I do is reverse it. And it's surprisingly easy.
What made you make the transition from?
I had a health journey on my own. I got sick. I got really sick. After, I think I attribute it to the stress of medical school and residency, the lack of sleep, addiction to sugar. I became addicted at a young age to sugar. I grew up in the 70s, so, sugar was...
The FDA came out, had sugar on the pyramid and said, hey,
sugar
get your servings.
I remember at certain people's homes that I would visit, there'd be a 2-liter bottle of soda on the dinner table, and that was just normal. It was a different time. I remember being at swim meets on the swim team, and before we swam, we'd be eating Kool-Aid right out of the little packet, thinking the sugar would give us more energy to swim faster. I know I always felt terrible after doing that. But so it was just different time, different science. But
remember Fun Dip?
I do. Yes, I remember that
Fun
fondly.
Dip. Fun
It's
Dip
still
growing
out there,
up.
by the way, because my kids still bring it home, like on Halloween and things.
Yeah.
Or school parties and things.
I mean, I used to do Fun Dip. I mean, I was an athlete. I used to think Gatorade was good for me.
Oh yeah, me too.
And that was actually for me. I think that's the cutting out sugar specifically, and I did it after college, like first year after college. I had terrible eczema my whole life. And I was very embarrassed about it because, like in the winter, especially, it would get really bad where it can just be like all over my arm, up to my armpits and stuff like that. And as soon as I cut out sugar in like 2014, like I'm sure I've touched sugar, and come across it, but I don't drink soda or Gatorade or candy at all. I mean, I'll put chocolate every once in a while. But I haven't had eczema in 6 years, 8 years now, almost. Which is crazy. And it was something that plagued me my whole life, the first 23 years of my life.
So it had something to do with the sugar and maybe even some of the processed food that the sugar was combined with.
Mm-hmm.
Like seed oils are another low-hanging fruit that I think are going to be interesting to follow. That the things that we were taught were healthy oils actually aren't, and the things that we were taught were unhealthy, like egg yolks and healthy
Tallow
animal protein and all of that sort of thing. I think gradually we'll learn, like everything, that the more we interfere, the more we seem to mess things up.
Right?
We could just get back to the basics.
Well, I'm big on the seed oil disrespecting train here.
I am too. And I think that's going to be a big... In fact, I had a migraine patient not too long ago that had suffered just almost disabled by them, and suggested that he go seed oil free. So I'll let you know how that, hopefully. But there's a good argument for doing that for inflammatory brain conditions, anything that causes brain fog or sluggish thinking, poor memory, poor motivation, that sort of thing. I think it's worth it for a lot of those patients, worth a try.
I mean, aren't there studies that like the seed oil specifically can lead to like the plaque in the brain that leads to Alzheimer's and dementia?
I haven't seen those specific studies, but I can tell you there's a good argument for inflammation in the brain, and inflammation is the root of all problems in the brain, I believe. In either a direct or indirect way.
Yeah. No, I need as little inflammation in my brain as possible. I've had 6 concussions. 3 were pretty bad.
Do you still have cognitive issues from those at all? Ever a little sluggishness or tired, or are you just trying to make sure they don't become a problem later?
Trying to make sure they don't become a problem later.
Because my concussion patients, getting enough sleep, eating a healthy diet, an anti-inflammatory type is critical. And then sunshine is hugely important for the brain for inflammation. So I tell them to get the early morning wavelengths of sun, which is near infrared, is probably the best. And sometimes I even recommend something called photobiomodulation, which is a helmet that delivers that near infrared light for brain healing.
Yeah, my last concussion was in 2010. Yeah, 2010. So 12 years ago.
But multiple concussions, you want to focus on brain health. And one of the best things you can do for brain health is watch your sugar. So you're doing that.
Yeah. Oh, so yeah, I cut sugar out 2014.
Sugar's inflammatory as well.
Yeah. Yeah. Gotta protect your brains, freaks. Pretty important part of the body, pretty important muscle there.
You can't protect your brain without protecting your whole body. I mean, you really just have to be healthy and well.
Yeah. That's why actually moving to Austin's been great for that, like getting outside. My wife, my son is outside like 8 hours a day. Like he just he cannot stay inside. So
keep him dirty.
Yeah.
All that dirt is so good for him and for his immune system development.
Yeah. We let him run around barefoot in the backyard. And
great.
Just, do whatever. We've got a pond in our backyard too. And
be careful. There's rattlesnakes around here.
I know. That's why I had to text a few friends. I was like, should I be worried about him running around barefoot? They were like, eh.
I have a good friend whose son was bitten by a rattlesnake in their front yard.
Really?
Did great. They went to the ER and got everything that they needed. But
kid's okay?
Kid's okay.
All right, that's good to know. Dang, I could sit here and keep talking for like hours, but you have obligations to get to.
I do. And I just want to clarify that I'm not here to judge anybody's decisions or promote or condemn any type of treatment. I'm just here to say that really it's a decision, an individual decision.
Yeah. And that's something we've been saying here. Like, I don't care what you do. Just don't try to force me to do anything one way or the other. Thank you for doing what you do. Thank you for sticking up for your patients.
Oh, I wouldn't have it any other way. I love my patients. I want the best for them.
Well, they're lucky to have you.
Thank you.
And yeah, we'll have to do this. We'll have to get more in depth into like the whole diet side of things at some point in the future. Is that something?
Sounds great. Let's do it.
Yeah.
We'll
Well,
talk more about maybe monetary things as well.
Yeah.
Next time.
Oh yeah, we can get into that as well. We actually had Andy Schoonover from Crowd Health. I don't know if you're familiar with that, but
I've heard of it. I'd like to learn more about that.
Yeah, there's some interesting ways in which Bitcoin is seeping into the medical industry, which is great to see. Because again, a lot of these problems are driven by the need for profit, and Bitcoin can lower the time preference of the industry and allow them to save and accumulate capital. Maybe they don't get caught in a perpetual motion machine of chasing quarterly profits for the sake of growth.
Right.
They can focus on health.
Yeah, I think the Bitcoin in beef is interesting. Bitcoin in freedom is interesting, and it will be very interesting to see how Bitcoin plays into the future of healthcare. To be seen, but I can see some potential benefits and freedom that it offers. I did opt out of all of the insurance just in order to not be told what I can and can't do for my patients. That was a big decision. So opting out of something to go to a better system can have, I think, huge benefits.
Your patients are happy people, I imagine.
I feel like it's a rewarding situation because they appreciate me, and I get energy from them doing well, and it's a win-win. Mm-hmm. We're coming together for each other's benefit, and it's a nice working relationship. It's like if you ever had, I consider myself the employee of the patient. If you've ever had a really good employee and you value that relationship and you're seeing good benefits and they're doing good work, that's kind of how I see myself. I'm there to serve, and and they come back and they keep me as their employee, I guess, because we do good work together.
I need to find a doctor like you, doctor.
Thanks. We're out there, and I think through all of the trauma that we've been through the past couple of years, there'll be more people who are choosing that relationship again.
Yeah.
I think the other system is just dysfunctional.
Yeah.
And I feel sorry for the doctors that are getting burnout. And
yeah, I don't think I've been to the doctors in like 3 or 4 years just because I'm like, I didn't like the experience, and I've always felt.
You're still young. You can get away with it, and you're probably pretty healthy. So, but focusing on wellness now is a great place to invest your time and your education in right now. Yeah, we'll talk more.
I got to work out more. I've been very busy. I've been working out enough, but.
Well, you should do the bone broth cleanse with us next week.
I am.
You are going to do it. Great.
Yeah. I've got my bones. I've got to make the broth.
I'll tell you, I wouldn't be able to do it if I wasn't accountable to everybody else. I just would put it on the back burner.
I do have one comment. It's on a Friday and a Saturday. It's like
it's a Thursday and a Friday.
Oh, Thursday and a Friday?
Right.
Okay.
And then Saturday is my birthday, so it's perfect.
Oh.
It worked out. I didn't pick the date, so I was like, okay, we're going to do the bone broth fast. Wednesday is fat loading. Thursday, I'm pretty sure that's right on the dates.
Mm-hmm.
Thursday, we're going to do bone broth and grass-fed butter or ghee, water, black coffee, black tea for 48 hours as a group. And then we're going to discuss our whys. Why is this important to us, and how are we going to get better? And then we're going to discuss our wins. Mm-hmm. And I think it'll be energizing to do it as a group. I think there's an unspoken energy when you work in a group.
Oh, I completely agree. It's
empowering.
motivation. I mean, if you've ever played team sports, like that motivation.
Exactly. So this is a big team. I think there's thousands of people doing it.
Yeah.
And maybe we'll do it, once or twice a year, long term. We're calling it the Bone Broth Challenge. Texas Slim and I just decided to do this because I was telling him how important it has been for so many of my patients. And
because it restructures your gut, right?
It really should be called the Bone Broth Reset.
Mm-hmm.
Yeah. It's anti-inflammatory. It helps restore normal flora. It heals the gut. All of that we'll talk about, but it's for most people, it has a profound impact on their health. So good. We'll be doing that together next week.
Hell yeah. Well, mentally preparing.
And the mental preparation is important because you've set your time and you're ready.
Mm-hmm. That, and like if my wife goes into labor during the bone broth challenge, am I going to stick with it? I think I'm going to try, but there's going to be a lot of stress. There's going to be a lot of emotions. I'm going to chug through with the bone broth.
A better story at the end.
Yes. I was fasting when you came to this world.
There you go. I was focusing on my health so that I could be the best version of myself. I was thinking about you and your best interest before you were even born, which we all have done.
I can hear my
there
wife. I can hear my wife screaming, "This baby's not coming next week. Shut up." All right. I know you've got to go. Thank you. This was an incredible conversation. Thank you for what you do.
Oh, yeah. My pleasure.
We'll do it again.